Why understanding the difference matters. We all know that feeling, right? That sense of accomplishment mixed with a bit of fatigue, that satisfying ache after a tough workout. It's a sign that you've pushed your limits and made progress. But what happens when the pain is sharper? When it feels more intense and localized, or sticks around longer than usual, when it doesn't seem to go away even after a few days of rest? Knowing the difference between muscle soreness and a muscle strain is crucial. It's essential for anyone who exercises regularly. It's not just about comfort, it's about protecting your body. Understanding these signals can help you avoid serious injuries. Misinterpreting the signals can lead to pushing yourself too hard and risking further injury. This can set back your progress significantly. So, let's break it down and learn how to tell the difference. By doing so, you can train smarter and stay healthier in the long run. The sweet ache of progress. Delayed onset muscle soreness, or DOMS, is that familiar ache that sets in a day or two after a workout. You challenged your muscles, and they're letting you know. It's actually a sign of your body adapting and getting stronger. Tiny micro tears in the muscle fibers are rebuilding, making them more resilient. This soreness typically peaks around 24 to 72 hours after exercise and gradually fades away. When pushing it too far backfires. Unlike DOMS, a muscle strain is not your friend. This is an actual injury to the muscle or tendon, often caused by overstretching or overloading. Imagine snapping a rubber band. That's similar to what happens with a strain. The pain is usually immediate and sharp, and you might even feel a popping sensation at the time of injury. Swelling, bruising, and muscle weakness are also common signs of a strain. Spotting the difference. Section 4. Soreness versus strain, spotting the difference. Understanding the nuances between these two can help you manage your workouts better and avoid potential injuries. So how can you tell if it's just DOMS or a more serious strain? First, consider the timing. DOMS, or delayed onset muscle soreness, typically sets in 24 to 72 hours after your workout. On the other hand, strain pain is immediate and can occur right during or after the activity. Location is another clue to differentiate between the two. DOMS usually affects the entire muscle group you worked, making your muscles feel tender and sore. In contrast, strain pain is often localized to a specific point, indicating a more focused injury. Finally, think about the nature of the pain. The type of discomfort you feel can be very telling. DOMS is a dull ache that can make your muscles feel stiff and tired, while a strain is sharp and often debilitating, making it difficult to continue your activity. Recognizing these differences can help you take the right steps towards recovery and prevent further injury. Treating soreness and strains. Section 5. Recovery routes, treating soreness and strains. Whether you're a seasoned athlete or just starting your fitness journey, understanding how to treat soreness and strains is crucial for maintaining your health and performance. Good news. Delayed onset muscle soreness, or DOMS, usually resolves on its own within a few days. Gentle stretching, light activity, and low-impact exercises like yoga or a light jog can help alleviate the discomfort and promote blood flow to the affected muscles. Over-the-counter pain relievers such as ibuprofen or acetaminophen can also be effective in managing the pain. Additionally, massaging the sore muscles can help to relieve tension and improve circulation. Strains, however, require a different approach. Unlike general muscle soreness, strains involve damage to the muscle fibers or tendons and need more careful attention. Remember the acronym RICE: Rest, Ice, Compression, and Elevation. Rest the injured area to prevent further damage, apply ice to reduce swelling and numb the pain, use a compression bandage to provide support and limit swelling, and keep the injured area elevated above the level of your heart to minimize swelling. Depending on the severity of the strain, you might need to see a doctor for further treatment. A healthcare professional can provide a more accurate diagnosis and recommend physical therapy or other interventions to aid in your recovery. Always listen to your body and give it the time it needs to heal properly. The key to safe and effective training. Section 6. Listen to your body. The key to safe and effective training. Pushing your limits is great, but always pay attention to your body's signals. DOMS is a normal part of the process, but sharp pain is a red flag. If you suspect a strain, stop exercising immediately and follow the RICE protocol. Remember, consistency is key, and preventing injuries means you can keep moving and crushing your fitness goals safely.